It's a very technical discipline, the concept of precision medicine, precision health, but I think primary care is really at the forefront of being part of that, because a lot of it is about understanding the environment and the way that environmental factors play into the context of precision health.
So precision medicine is the future of healthcare. This is where medicine is going. It is happening around the world, but in all parts of Alberta, this will happen as well. The most simple definition of precision health is it is the use of deep knowledge about either a patient or a population, and using that knowledge to make a precise diagnosis and management stream for that patient or population for whatever it is that we're looking at.
Precision medicine is I think at the Cummings School of Medicine is the area of research that we've chosen to focus on, and it's a super exciting area of research. But it's an area of research that has to benefit all Albertans. Physicians who are going out into rural environments to practice, it gives them an opportunity to take that same deep knowledge and apply it in a really different and really interesting context, and maybe even to apply it in innovative ways that are different, so maybe substantially different than in the urban environment.
Particularly in a rural community, you can really start to understand a lot of the environmental factors, particularly if it's an industrial community or a mining community or agriculture-based. Those all do play into the concept of precision health, which is really sort of looking at the patient within their environment and the impacts that everything has on them.
But the other side of precision medicine is just recognizing that certain groups of people are different than other groups of people, and that certain groups of people have different risk factors and have different socioeconomic status and have a whole number of things as part of that as well. So you don't necessarily provide the best care to a rough and tough old rancher from 20 miles west of Claresholm if you don't understand what the life is that rough and tough rancher has lived.
There's the disease, and then there's the illness. You can't just treat the disease. You have to treat the person that is experiencing that disease, and that's what we call the illness. It's the illness context. Yes, they've just been diagnosed with, say, diabetes, but how does that make them feel? How is that going to change their role in the community and the role in their families and like as well too?
The real power of how precision medicine will be applied in a rural setting is that it will be applied in the context of a strong physician-patient relationship, and that no matter what the precision dictates in terms of a direction or a risk, that the interaction between the patient and the physician will be at the center of that discussion.
You know what's appropriate for that individual, or at least feel that you can, as a person, on multiple levels, and then you can gear interventions that make sense for that person. So I know that I can provide dialysis to an 82-year-old person, right? And I know what's going on a molecular level with dialysis. But I also know my patient, that 82-year-old person would never ever want that, no matter what, because I know that they come from a small community and a tradition that would be very, very much against dialysis.
The role of the family physician that I see here, and that I've experienced in other rural locations too, is to really advocate for a patient and make sure that they get the health care that's appropriate for them.
All patients are treated on an individual basis. And because we're a team, we all get to know the patient a little differently. And I think because of that, and because all these people are part of the community as well, you really get to have a precise sense of what matters to each patient and what is valuable for their medical care.
But precision medicine is about precision education as well. And when you train people in the location where you want them to practice, that's about precisely giving them an experience that allows them to make a decision. Precision medicine is about having people select for practice that they might not have thought of before. And they find out that they have the skill set, and it's very fulfilling. That's precision medicine as well.
So I think the real success for precision health in rural Alberta will come from the unique capabilities of our rural physicians to look after the broad breadth of disease that we see in rural Alberta, and using the incredible data that will come from precision health. These will be tools that the rural physicians of Alberta will put to extremely good use in the future.